Hello and welcome. We would like to introduce you to VetDAR, Veterinary Digital Anesthesia Record-Keeping Software. This software allows one to continue the transition to paperless veterinary medical records. The software adds efficiency, decision support, and safety to veterinary anesthesia. Today, I would like to give an overview of some of the features of VetDAR. In order to do that, we'll open the program and log on to VetDAR. The default password is password. We will type it in and the program will open. Initially, one will see the splash screen containing the version number of the program, and next the user will be asked to accept responsibility for the use of the drugs. The software is preloaded with a formulary of anesthetic and anesthesia-related drugs. After one enters the species and body weight of the patient, the software will automatically calculate the doses of anesthetic and anesthesia-related drugs for that animal. The species that are included are dogs, cats, horses, cattle, sheep and goats, swine, and camelids. The doses in the formulary are the ranges for healthy animals. Sometimes those doses may be too high for compromised animals, and the selection of the dose may be adjusted. The disclaimer asks the veterinarian to adjust those doses based on the animal's physical status and to accept responsibility for administration of the drugs. When we get into the program, there are several options for the user to implement. One can click on the program icon to access the pull-down menu, and there are several choices: new case, open case, close case, save, print, administrator login or logout, reviewer actions, program settings. There's a quick start guide and documentation, check for updates online, about VetDAR, and exit. The new case prompt is used to initiate a new case. In some instances, a new case can be begun through the use of Applications Programs Interface software. That software allows patient demographic information and the owner's name and contact information to be transferred from the facility's hospital information software into VetDAR. To open a pre-existing case, one will click on Open Case, and a list of active cases will appear in most recent first order. Cases in the database include those that have been anesthetized and those called active cases. Active cases are those entered in the software but have not yet been anesthetized. One can search by patient ID or case number, patient name or owner's name. One can also search for all active cases to obtain a shorter list from which to make a selection. One can also select cases based on when they were anesthetized. Choices are today, yesterday, and last week. When one searches by patient name or owner name, one may obtain a list of several animals with the same name, or the owner may have more than one animal in the database, so caution is needed to select the correct case. Lastly, one can also search by participant to obtain a shorter list from which to make a selection. The close case prompt is used to close your currently open case. Use of the saved prompt allows the user to save the complete record or its individual components as a PDF file. Use of the print prompt allows the user to print selected individual components of the file. These prompts are gray because there is not a currently active case. Next is the administrator login prompt. When one wants to log in as an administrator, the default username is admin, and the default password is admin. This feature allows one to add personnel, drugs, procedures, etc. to the program settings. Being logged in as an administrator also allows one to perform reviewer actions, such as approving cases, viewing deleted cases, and data review. Approve case is the prompt used to lock a completed record as a PDF file. After the case is locked as a PDF, it can no longer be altered. Up until that time, mistakes or inaccuracies in the record can be corrected and edited. View deleted cases is the feature used to restore an accidentally deleted case. Data review is the feature that allows one to save the data to an Excel file for more extensive searches. One can also access the program's settings. This opens another pull-down menu and allows one to select or change the active monitors that are available for use in the software, add administrative users and assign them a password, select additional medical gases, and record their use in the anesthetic program. One can also change the headings of the patient assessment form by clicking on that prompt. One can change the program password if desired with this prompt. One can click on the timers prompt to change the intervals from 5-minute frequencies for vital signs and 30 minutes for body temperature to either less frequent or more frequent. One can click on the list terms to open another pull-down menu. This pull-down menu allows the user to make additional changes to the default settings for vascular catheterization, breeds, complications, fluid types, laboratory tests, participant name and type, procedures, recovery quality, recumbency, species, and units. One can access the VetDAR documentation file and the Quick Start Guide by clicking on the appropriate prompt. There is also a Check for Updates prompt, which will check the Dimple Hill software website for program updates. And one can click on About VetDAR to view the license information. Lastly, you can exit VetDAR. If one is logged in as an administrator, then they would use the Reviewer actions in order to access the Delete Record feature. This feature is to delete a sham record, one that is done for training purposes or when a case has been entered in the program and then has been canceled. After using the Open Case prompt, one would select the file to be deleted and click the Delete Case button. If a case has been inadvertently deleted, an administrator would log in, click on Reviewer Actions, and select View Deleted Cases. A list of deleted cases will be displayed. That case would be selected and then the Restore Case button is clicked. In order to show more about VetDAR, we will open an active case. When you have a case entered in the software, several ribbons of icons become accessible to you. The different buttons for the ribbons are arranged in chronological order as one progresses through a case. Buttons include case information, patient assessment, pre-induction, induction maintenance, and recovery, with each button having its own ribbon. The case information ribbon allows entry of background information for the cases and includes buttons for patient information, owner information, the procedure, personnel involved, patient signalment, the physical exam results, and laboratory test results. The second button opens the patient assessment ribbon. This feature is designed for use in a teaching hospital and to help veterinary students organize their thoughts before anesthetizing an animal. The buttons included are fields devoted to important recommendations, potential complications, preoperative evaluation, pre-medication, induction, maintenance and monitoring, fluids, ventilator settings, analgesia, the pain score, and recovery concerns. And lastly, approval of the patient assessment form. In important recommendations, the user can enter important information regarding anesthetic management, like the presence of pulmonary Ebola, for example. Potential complications that may occur under anesthesia can be entered using the pull-down menu. In the preoperative evaluation dialog box, one can write the results of the animal's physical exam. In the pre-medication field, one can record the drugs they wish to use, their reasons for using them, routes of administration, and potential complications. In the induction field, one can record the drugs they wish to use, the reasons for selecting them, routes of administration, and potential complications associated with their use. In the maintenance and monitoring field, one can record the drugs they wish to use, their reasons for using them, and potential complications. One can also record the types of monitors they wish to use on this patient and types of intraoperative testing they wish to perform. Clicking on the Fluids button will display a field for the user to enter the fluid bolus volume for this patient. Clicking on the ventilator settings will allow the user to enter the tidal volume and respiratory rate they wish to use for this patient. In the Analgesia button, one can record the analgesic drugs they wish to use, the routes of administration, their reasons for using them, and potential complications associated with their use. In the Pain Score dialog box, one can enter the patient's current and predicted pain score. With the Recovery field, one can record potential complications that occur during recovery and other concerns they might have. Finally, approval of drug selection in the patient assessment can be made by supervisory personnel. Once again, this ribbon is designed to be used by veterinary students and other trainees to help organize their thoughts. Once one reaches a certain skill level, this section does not need to be completed for every case. The next ribbon is the pre-induction ribbon. The first button is the pre-anesthetic drugs. Here one enters the drugs and the amounts they are going to use and the route by which they are given. The next button is the physical status dialog box. This box allows one to enter information regarding the patient's status, including a field for comments relating to the patient's comorbidities, temperament, etc. The next button opens the sedation present dialog box. This field allows the user to record the effects of the pre-medication drugs and cannot be completed until after the pre-anesthetic medications have had time to exert their effects after administration. The next button is the induction drug dialog box. This is where one enters the induction drugs and the amounts that are going to be used and the route by which they are given. The next field is the maintenance drugs field, where one will enter the maintenance drugs and the amounts that are going to be used and the route and type of system by which they will be administered. The next field is the intubation dialog box. In it, the user can record the type of intubation, whether it be oral or nasal, tracheal or bronchial, and the size of tube that was used. The next dialog box is a catheterization and fluids dialog box. In it, the user can record the vessels which were catheterized. There are a number of vessels that are preloaded into the software. We can also record the type of intravenous fluids that are administered and the rate and route. The last field to be completed is the blood pressure monitoring dialog box. In it, we specify whether blood pressure was monitored invasively with an arterial catheter and pressure transducer, or indirectly with a Doppler flow probe or oscillometric technique. The cuff size is also recorded. The last two buttons allow one to access two of the formularies, when the user enters species and body weight of the animal. Clicking on the pre-medication button will open a formulary that lists all the sedative and tranquilizer drugs and doses calculated for this animal. The anesthesia formulary will give you access to all the anesthetic-related drugs and doses calculated for this particular patient. Continuing on, we will click on the Induction Maintenance button to open that ribbon. There are many buttons in this ribbon, and you'll notice that some of the buttons are grayed out and won't be functional until anesthesia is begun. The buttons for beginning and ending anesthesia and beginning and ending the procedure are used to note start and stop times of those events on the anesthetic record. The software will calculate duration of anesthesia and the duration of each individual procedure. Buttons for the vaporizer setting and flow meter settings are used to note changes in the flow meter and vaporizer setting. When one clicks Begin Anesthesia, the software will automatically ask the user to complete dialog boxes for the vaporizer setting and oxygen flow rate, if an inhalant has been chosen for maintenance anesthesia. After the initial settings are made, one would click on either button whenever a change in the vaporizer or flow meter setting is made. There are also buttons for other medical gases, nitrous oxide, medical air, and heliox, if one has the occasion to use them. Next is a toggle for recording the use of a mechanical ventilator. Sliding the toggle to the right will open a dialog box asking for the ventilator settings. After completing that field, that information will be displayed as a time-stamped remark in the anesthetic record. Beneath the toggle is a button for changing ventilator settings. Clicking that button will open a dialog box populated with current ventilator settings, and after updating those settings, that information will be displayed as a time-stamped remark in the anesthetic record. When one begins a case, a dialog box for vital signs data, heart rate, respiratory rate, pulse oximetry, etc., will automatically open at user-defined intervals, usually every 5 minutes. After that data is entered, it will be plotted and displayed graphically on the record. If one wants to record vital signs data earlier than the next scheduled entry, then one clicks on Record Extra Interval to open the vital signs dialog box. One is asked to record body temperature at 30-minute intervals. Similarly, if one wants to record body temperature earlier than the next scheduled entry, one would click the temperature icon. The next button is Add Medication. This button is used to record administration of any medication that is given while the animal is under anesthesia. Clicking on the icon opens a dialog box asking for the name of the drug. Many are preloaded into the software, and the amount, the route of administration, and the purpose for the drug. One saves the information and then closes the box. When the box is closed, a time-stamped comment is recorded in the remarks section detailing the drug's name, amount, and route of administration. Additionally, the information will be entered in a table summarizing the medications administered during anesthesia. The next icon is for recording results of blood gas analyses. Clicking on the button will open a field where one can record the results. When the field is closed, a time-stamped comment will be placed in the remarks section of the record to note that the blood gas analysis was performed. Additionally, one can click on Previous Blood Gas to review the results of previous blood gas analyses. While VetDAR plots and displays the data on the graph, it also records the data in a spreadsheet hidden in the background while the case is ongoing. Clicking the View Data button will open that spreadsheet and allow one to view the data and edit incorrect information. If one wishes to refresh the page, there is a button for that. As mentioned earlier, there is a button for the Complete Anesthesia Formulary. There are also buttons for the Emergency Drugs Formulary and Recovery Formulary. The Emergency Drug Formulary has the doses of several of the drugs used to treat animals in emergency situations, in addition to calculating the mass of the drug needed The software also calculates the volume of the drug needed. This formulary also calculates the tidal volume for mechanical ventilation and the fluid bolus volume. Clicking on the recovery formulary will open a field that has a list of drugs used to treat dysphoria and/or pain during recovery and those doses. Clicking on the bicarbonate calculator will open a dialog box that enables the software to calculate sodium bicarbonate requirements if the user enters the base deficit. This button is a drop calculator. If one is administering intravenous fluids by gravity, selecting the type of intravenous administration set used will allow the software to calculate the number of drops given per second, minute, or hour. When one enters the species of the animal being anesthetized, VetDAR populated the case with normal values for vital signs. If one wishes to adjust the alarm settings, one would use the Alarms On button and select the individual parameter one wishes to change. If one wishes to disable the alarms, they would slide the toggle bar to the left. The last ribbon is the recovery ribbon. When one clicks End Anesthesia, the software automatically transfers the user to this ribbon. When recovery is complete, one clicks the Recovery Complete button. The software will calculate the duration of the recovery. There is a button for recovery quality. After clicking on it, a dialog box will be displayed asking that the type of recovery be characterized. There is also a field for additional comments about the recovery. Clicking on the Complications button will open a pull-down menu with a partial list of complications, including none as a choice. If a complication has occurred that is not listed, then one can click on Add New, log in as an administrator, and add that new complication. Next is a button for the medication totals. Clicking it opens a table that contains a list of all the drugs used during anesthesia. One completes this, noting how much of a drug was given or how much was discarded. There is a button entitled Other. Clicking it gives one additional choices for ending anesthesia. They include patient died and patient euthanized. Access to the recovery formulary is also provided in this ribbon. Next is a button for a synopsis. This report is used to compile a summary of the case for use as a document to send referring veterinarians. It can also be used as a place to record additional information regarding events and interventions when complications occur, if that information exceeds the space available in the remarks section of the record. There are also buttons for the various reports that VetDAR can generate. They allow one to view the patient assessment form while the case is ongoing. After the case is completed, one can view the anesthesia report, the blood gas analysis report, anesthesia data report, the summary, and the synopsis. The anesthesia report is a report that looks like a traditional anesthesia record. The blood gas analysis report contains data from the blood gas analyses performed during anesthesia. The anesthesia data report is a spreadsheet of all the vital signs data. The summary summarizes the drugs used during anesthesia and the duration of anesthesia and recovery, duration of mechanical ventilation, and the duration of the surgical and/or diagnostic procedures. The synopsis can contain additional information about case management. The next button is used to approve the totals of the drugs dispensed, administered, and discarded. When opened, one can enter the initials of 2 witnesses. The last button is used to submit the anesthetic record for final approval. Clicking this button is done to place the record in a queue for an administrator to review, make final edits, and then save the record as a PDF file, after which it can no longer be edited. This concludes an overview of VetDAR.